Sudah kira-kira 2 tahun kita berdepan dengan pandemik COVID-19 dan walaupun sudah banyak kita tahu sejak 2 tahun lepas, banyak lagi yang kita masih belum dapat pastikan dalam tempoh ini. Apatah lagi dengan kemunculan varian-varian baru, malah penyakit baru berkaitan COVID-19 seperti Flurona dan sebagainya. Jadi apa yang kita tahu setakat ini dan apa yang kita telah pelajari berkenaan dengan wabak ini untuk kita boleh membendungnya dengan lebih efektif bergerak ke hadapan. Kerana ia adalah sesuatu yang kita perlu hidup bersama dengannya dalam tahun-tahun akan datang. Nah, satu komponen yang penting berkenaan dengan pembendungan COVID-19 sudah tentu adalah vaksin COVID-19. Dan selaku salah satu vaksin utama yang digunakan di negara ini, Sinovac. Pengimportnya Farma Niaga Berhad ada banyak perkara yang mereka mahu kongsikan berdasarkan kajian dan juga dapatan yang terkini. Saya mahu berbincang bersama dengan Ketua Biologik dan Pakar Vaksin untuk Farma Niaga Berhad, Dr. Ajit Pal Singh. Doctor, thanks so much for joining us.
Thank you. Thank you for having me here.
First of all, can you just share with us the current progress of the clinical studies in Malaysia for the Sinovac vaccine?
Okay, currently we just completed one immunobridging study where we showed that the vaccine filled in Farma Niaga is same to vaccine imported from China, because we are also doing fill finish by importing bulk. But there's a very critical study which is ongoing, and this is a pediatric study where 2 doses are given to the children up to 3 years of age, starting 11 years. In fact, we are part of a bigger global cohort where the children are being vaccinated up to 6 months of age. It's a 14,000 subject study being done in 4 countries, including Malaysia, Philippines, Chile, and South Africa. And currently, study has completed more than 4,000 subjects. Malaysia itself completed 1,000. We expect to complete the entire enrollment by April this year, and then the study results will be out for pediatric efficacy by around May of 2022.
Now, of course, as we know, there are a number of new variants, and the most concerning of all is, of course, the Omicron variant, which is the dominant variant in a lot of places at the moment. What do we know so far about the efficacy or the effectiveness of the COVID-19 vaccine against this new Omicron variant?
We know Omicron is a variant which has mutated, and there are substantial mutations from the earlier Wuhan strain. And in fact, on the spike protein itself, there are more than 30 mutations. So we know for sure that the vaccines which were made using the Wuhan strain will not be as efficacious as they were against Wuhan. However, what we have seen that when we boost the 2 doses of a primary vaccine, the high antibody response is actually able to neutralize antibodies against Omicron also. And it has been also seen that 2 doses is not as effective in the efficacy studies. The studies done in South Africa, Israel, where now currently 70% of the circulating strain is Omicron, we have seen very, very reduced efficacy for earlier vaccines. This was also seen in the lab studies where the capability to neutralize Omicron by the 2 doses is significantly reduced. Hence, booster is given. And booster is also recommended because booster is going to boost the antibody response, and in fact, it helps in generating antibodies against Omicron also. That's what we have seen with studies with Sinovac as well.
And yeah, speaking about that, Sinovac has also released a very positive report with regards to Omicron. Can you just summarize that report for us? What does it say? What do we know?
Right. Very interestingly, there were 3 results which were published by Sinovac last week. The first study was done in China, around 120 subjects, where they compared the response against Omicron neutralizing antibody with 2 doses compared to 3 doses. 2 doses given 1 month apart, and the 3rd dose booster, which is given at 0, 1, and 7 months. So a booster given at 6 months. We have seen neutralizing antibody capability in 95% of the subjects who have received 3 doses, the booster dose, compared to only 3% of the subjects showing neutralizing antibody when they were given 2 doses. In addition, researchers also analyzed the type of antibodies which were produced after booster dose. We have seen there are around 300 type of antibodies which are produced, and out of these 300, close to 85% of these types of antibodies are showing killing effect against Omicron variant. In fact, more than dozen type of antibodies. They are actually they are first in, I mean, they are the best in class antibodies showing a direct effect on the binding capability of Omicron to the human body. So it is those antibodies are showing as good effect as shown against Wuhan variant in the past. So we believe that the third dose is actually not only increasing the breadth of antibodies, but it's also increasing the amount of antibodies which are directly related against for protection against Omicron.
No, it's not. Sorry, go on.
The third study, which actually came out from Chile, when we give a vaccine, we have two types of protection in body. One is the antibody protection, the other is the cell-mediated protection. We have not seen a cell-mediated response when we give 2 doses of Sinovac vaccine, but when a third dose of Sinovac vaccine is given, it produces a cell-mediated response, and we have seen the response of this cell-mediated memory similar to the Wuhan strain as against Omicron, so that when you get the Omicron infection, the body T lymphocytes can actually produce similar amount of chemical which can kill Omicron strain. So these 3 data recently published actually supports the fact that a third dose is kind of must if you want to give adequate protection against Omicron.
Now, it's not just Omicron that we have to be worried about. There seems to be a lot of almost mutant diseases popping up. Flurona is one of them. We are only just hearing about Flurona. So what is Flurona, doctor? And should we be worried about it?
I mean, Flurona is a misnomer. So, what Flurona is basically, we have regular flu, influenza disease, influenza virus causing the flu-like symptom. And the influenza virus symptoms are exactly same as the COVID virus symptoms. So an influenza happen by hemisphere. The countries which are below the equator, they get influenza usually from April to September in that period. And last year we have not seen the peak of influenza or the seasonal flu here because of the restrictions, lockdown, people were not moving around. But this year we expect the influenza to be happening in a normal way. And if the influenza also happens and there's already an existing COVID burden, either due to Delta or the new variant Omicron, you may get 2 infections together. And that is something called Flurona, flu as well as corona, both the infections together, having the same symptoms. So there's a possibility that you may get double the number of cases. The healthcare infrastructure will be overburdened, and there may be higher symptoms, higher respiratory symptoms, and people need to seek medical care more as compared to what we are seeing in Malaysia now. We don't have that much of infection now. Infection has kind of plateaued. But with Flurona situation, hypothetically, it may go much beyond what we are expecting.
Yeah. But on a personal level, what can we expect from Flurona? If I, for example, have caught Flurona, do I expect the side effects or what I will go through is quite bad compared to just getting COVID, or what do we know so far?
It's technically a double pandemic. So better everyone get vaccinated against the flu strain. WHO declares a new flu strain for this year already, and the vaccines will be available pretty soon. So everyone in Malaysia should get flu vaccination in addition to the booster vaccination, to avoid that Flurona kind of a situation where you have both infections. You are having flu, and on top of it, you got COVID.
Yeah. So you've kind of led into my next question, which is going to be, do we need a booster dose? I think you've answered that quite sufficiently. So, but rather, on top of that, how many doses of the COVID-19 vaccine do we expect we need moving forward? This seems to be the question on everyone's mind now.
Actually, now situation is very fluid. We see quite a few cases in Malaysia, and there's a plateau maintained for the last few weeks already. But if you look at the other countries, the Western countries, there is a very big spike of Omicron. And it's just a matter of time that Omicron will be coming here in Malaysia as a 4th wave. I hope it not, but all scientific data and studies indicate towards the world probably getting Omicron wave in next few months, including Malaysia. We know that the booster vaccine is still effective, and we believe that 1 month after booster, we can still get protection against Omicron. But how long this protection lasts, these studies are still ongoing. So we have 1 month data. but we are waiting for a 3-month booster efficacy data and a 6-month booster efficacy data. We'll know how long it will affect, but the bigger issue is it may mutate, and it may mutate to a strain which is bypassing the immunity given to us either by previous infection or by the earlier vaccines. So nobody knows the real answer, how long or how much boosters we need, but we definitely need the booster. And the WHO also recommended that companies should start working on Omicron variant vaccine as a standalone or as mixed vaccine with Wuhan, Delta, Omicron, so that we are kind of prepared for a situation if it arises of a new variant or Omicron taking over and Omicron causing more significant disease.
How would we know, at least semi-conclusively, how long a protection does a vaccine give us? You mentioned you guys need at least 3-month efficacy data. Is that the minimum amount of data needed for us to actually determine how long of a protection do you get when you get one dose of vaccine?
Okay. So the question is actually different. The question is, for the Wuhan strain or the Wuhan-based COVID, the protection we know lasts around 6 to 9 months, and you have to have a booster. But if the strain change to data, as earlier it changed to Gamma and Delta, we still know that the protection can be there for 4 to 6 months. But now we have Omicron, which has a significant amount of mutation and very different from Wuhan was. So protection was very low. It depends on what is the new variant coming in. The vaccine protection lasts as long as the strain stays the same. The idea is to vaccinate everybody globally. That's what WHO and other global health bodies are promoting too, so that we get vaccinated quickly. We stop this virus to multiply and stop mutation. Once we are able to control the mutation, then only we can talk about how long the vaccine lasts. If there's a new strain and the vaccine may not be effective, then there's no protection from the earlier vaccine.
Now, there's quite a significant chunk of the population who are still unvaccinated, which are children. Now, in this country, in Malaysia, we've just started giving approval for the vaccines to actually be administered to children as young as 5 years old. So that's the initial group of vaccinations, by which I mean the first and the second dose. But now there's also a debate on whether children need boosters as well, i.e. the third dose of vaccine. Right. What do we know about this? Do children need a booster dose as well?
Okay. We know that with the Wuhan variant, the disease was very less and less severe in children compared to adults. And after the change of variants to Gamma, Delta, and now Omicron, of course, Omicron is very limited data in Malaysia. We know that the children are mainly asymptomatic, and severity in children is very low. However, in order to generate the herd effect from the immunity so that the virus stops multiplying, we need to vaccinate this group of children to remove this reservoir. If all the adults are vaccinated, let's say in Malaysia, close to 90% vaccinated, the virus will still be multiplying in pediatric cohort. It becomes like a reservoir for virus. And when they get chance, they will infect elderly or the one which are comorbid or one which have less immune system to protect themselves. So in order to stop that reservoir and also to stop mutation of this virus, the children has to be vaccinated. Currently, all the vaccines which are available in pediatric age group are for 2 doses, for the primary dose, like Pfizer is approved. We have also applied to NPRA for approval 3 to 11. We already got approval 12 to 17 years. We are very hopeful that we will get probably approval very soon. And so far it's 2 doses. But if you ask me, the way we have seen the 2-dose efficacy in adults, we may also have to have a booster dose in pediatric population. And currently the studies are being designed to evaluate a booster dose in pediatric population.
Now, there's still a lot of apprehension from parents about actually giving their children vaccines. I mean, never mind people who are vaccine hesitant. I know people who took the vaccines for themselves, but as soon as approval was given for children to take the vaccine, they become just a bit more apprehensive. I think it's normal for people to be kind of overprotective of their children who they view as, being very young and very fragile. So what do you say to these people who still have fears and doubts on whether they would sign up their children to get the vaccine?
The apprehension is not baseless, actually. The children are having very minimal disease. You don't see symptoms at all. Most of the children, close to 80%, are asymptomatic. And the one who has symptoms are mainly category 2, will have their mild symptoms, cough and cold. So a child which is not actually sick, and then you're giving a vaccine, and the vaccine actually causes some kind of side effects. What we have seen for some of the vaccines in adolescent population, the most critical side effect, which is myopericarditis, is seen close to 1 in 20,000 vaccine recipients, which is 12 to 17 years male mainly. That is a bigger cause of concern, because though the event itself is reversible, but the event itself is quite serious, has a capacity to actually become very serious if undetected and untreated. So that's the concern. That's why the vaccine, the mRNA vaccine we used to cause this myopericarditis, they have reduced the dose in pediatric population to 1/3. We still have to see whether this is how it is behaving less with more safely in pediatric, because some countries have just started to roll out, and we know some countries like UK, they are very cautious, and they have increased the the gap between the two doses from 3 weeks to, let's say, 8 weeks. They are also contemplating that we may defer the second dose up to 12 weeks in this population, just to make sure that how to monitor the side effects. Compared to Sinovac has not, it has been shown very, very safe in pediatric population. I would like to mention here, China and more than half a dozen countries have rolled out Sinovac in pediatric age group. China has vaccinated more than 250 million doses in children 3 to 17. And we have seen no new side effect. We have seen no aggravated side effects, what has been seen in the adults. And there has been no case of myopericarditis with this kind of vaccine. So what my recommendation would be, or suggestion would be, in pediatric, you have to choose vaccine very carefully, because the disease itself is very, very mild. Now, you cannot choose a very, very highly immunogenic vaccine in a population which is having a mild disease. So you have to balance between safety and protection.
I want to go back to this booster dose. Now, there are some reported cases, albeit being very anecdotal, but there seems to be a slight increase in so-called incidents where people reported having more severe side effects, even reported deaths. But I think it's needed to put on record here that as of this recording, there have been no severe cases or deaths actually related and officially related to the taking of the booster dose. But there have been more noise as opposed to when people were just taking the first and second dose. So what do you make of this, Doctor?
It's not Malaysia, it's globally, where one particular kind of vaccine is being used, mRNA. It's known to cause these cardiac side effects, and they happen to be more with the subsequent doses. It's mainly due to the scientific reason why this is happening. And second, also, people are now more aware of these kind of side effects, and they monitor themselves for any chest pain, breathlessness, post-vaccination, and quickly report. What we are seeing now of these side effects, they are happening in the 12 to 17 age group, which is group of concern, because pediatric population is even lower, is 1 in 20,000 doses given. And that was the main reason why the pediatric dose, 5 to 17, was reduced 1/3 from the adolescent dose of 30 microgram per dose. However, this kind of phenomena is not seen for a kill vaccine like Sinovac, because it's a different platform technology, and there's no cardiac pericarditis, myopericarditis after first dose, and even the side effects are reduced after second dose and booster dose. So considered to be a much safer vaccine compared to other.
Right, now, Pharmaniaga, of course, plays a major role in bringing in the Sinovac vaccines to be administered on Malaysians. Any future plans for Pharmaniaga to actually expand its vaccines portfolio?
You're talking beyond the COVID vaccine or within the COVID vaccine?
Both, within the COVID-19 vaccine and also beyond that.
Okay. Within the COVID-19, we are working on a double dose booster. And we are also working along with Sinovac with the new strain, Omicron strain vaccine, and which will be going into phase 2/3 study sometime February this year. In addition, we are also working on a new platform technology along with Sinovac, because they are our partner for COVID vaccination program. And that vaccine will be a multivariant vaccine where you can, within the same vaccine, you can have multivariant components, probably to be made available by Q3 this year. So these are the few COVID vaccine in pipeline. In addition, Bhamanyaga actually established its vaccine manufacturing plan way back in 2017. And we have almost all of the National Immunization Program vaccine. Malaysia has an NIP, National Immunization Program, where you give compulsory vaccine to pediatric population. And then there are vaccines for elderly and adolescents, like HPV for young girls, varicella and zoster for elderly. And then we have the 6-component vaccine for pediatric, pneumococcal vaccine, which was just introduced in NIP last year by Malaysian MOH. We have all these vaccines in our pipeline, and we are currently establishing our fill-finish facility in the same place where we are filling the COVID vaccine in vial. We will be coming up with few more vaccines, sometimes in 2 to 3 years from now, in vial as well as in pre-filled syringes.
Now, COVID-19 is something that we have to learn to live with. I think most, if not all, scientists around the world have agreed on that. It's going to become part of our lives, but it's just a goal to make it an endemic rather than a pandemic. So in light of that, how far is Malaysia from actually being able to produce its own vaccines for COVID-19?
Okay, so currently we don't have a capability to produce the bulk antigen, the actual antigen for vaccine. Bhamanyaga is going to set up in collaboration antigen manufacturing capability in coming years. And I see by another 2 to 3 years, by 2025, Malaysia, through Bhamanyaga, will definitely have a bulk antigen manufacturing capability, which is not only for COVID, but for other vaccines also, like flu vaccines and other vaccines which have pandemic potential. So we are internally ready. If there's a new pandemic or new epidemic, we can produce our vaccine much quicker than we did for COVID.
Doctor, thank you so much for your time.
Okay, thank you.
Dr. Ajit Palsing, Ketua Biologik dan pakar vaksin untuk Bhamanyaga berhad, dan pada anda semua di luar sana, jika anda masih lagi belum mengambil dos penggalak vaksin COVID-19, malah jika anda belum mengambil dos pertama dan 2 sekalipun, segerakanlah ambil untuk kita menjaga kesihatan kita semua bersama-sama agar kita boleh kembali kepada kehidupan yang senormal mungkin sebelum pandemik ini tiba di negara kita. Terima kasih kerana menonton Agenda AWANI. Saya Luqman Haris. Kita jumpa lagi. Assalamualaikum dan salam hormat.